What should a doctor do in case of death of a patient suspected of having COVID-19 in a hospital, especially when the investigations for confirming COVID-19 of that particular patient are pending? An unfortunate case has been reported from AIIMS Patna. The body of a patient who was suspected with COVID-19 was handed over to the relatives without waiting for the results of the investigation reports that were pending at that point in time. The patient had travelled back from Qatar, was admitted for chronic kidney disease, and he died on the next day of admission. The hospital authorities accepted that the report confirming that the patient had COVID-19 was received by them much after they had handed over the body of the dead patient to its relatives. The body was handed over to the relatives wrapped in polythene. Interestingly, medical science is still not sure whether the virus can be transmitted from a dead body. The accepted view till date is that it is transmitted by coughing and sneezing. We are not aware what happened further in that case, but there was one circular, one advisory rather, that was issued by the Ministry of Health and Family Welfare, Government of India, on 15th March 2020. It is a very specific advisory on the management of dead body. This advisory is limited to hospital death. It lays down standard precautions for healthcare workers and family members of a dead patient in handling, in packing, in removing, in handing over, in transporting, and finally disposing of the dead body of both suspected and confirmed COVID-19 patients. It also stipulates the procedure for disinfection of the materials which are directly and indirectly used for any procedures, including autopsy performed on the dead body. This advisory has been issued for both hospitals and citizens. Interestingly, this advisory does not speak about deaths, how to deal with the dead body when investigation reports are pending. Two simple do's and don'ts. In case of death of patient suspected with COVID-19 and where the investigation reports for confirmation are pending, please do not hand over the dead body of this patient to the relatives or attendants. Wait for the investigation's report to come. Once it is confirmed or not confirmed about the status of the patient, you have to proceed accordingly. In case of death of a patient who is confirmed of being infected with COVID-19, every doctor, every hospital has to follow the SOP, the advisory laid down by the Government of India in its advisory dated 15th March 2020. Thank you.